Here we go, guys. Okay, sorry, we're starting a little late. I am not Dr. Faisel Syed. So thank you so much for joining. We're very excited to be here. We had some early audio issues, but I'm glad to be here personally. As you can see, I'm on Dr. Faisel Syed's Instagram today. I have taken over Fridays with Faisel. And so Dr. Syed's son is actually in having a health situation. And so we found out recently. And so I'm actually going to do the show today solo. And we'll be able to take some questions and hopefully invite some people to come on the show and actually ask some questions. So today we're talking about a continuation of last week's show, which was about social determinants of health. And during the intro to social determinants of health, Dr. Syed kind of explained that a lot of the things that influence health conditions and health outcomes are related to sort of social circumstances rather than what the kind of typical belief is that it's sort of a biomedical circumstance. So a lot of times things like housing instability or food insecurity or social isolation are factors that are associated with bad health outcomes and the use of kind of high cost services like emergency departments and inpatient stays and the exacerbation of chronic conditions. And so today on this show, we're specifically going to be talking about how virtual care can impact two specific outcomes. One is access to care, and the other one is social isolation and loneliness in older adults and really in anybody in the population. So why don't we start with talking about how virtual care really can improve I guess what I should say is the core benefits of virtual care are really access from lots of different points. If there's a device and internet, people can access a wide variety of healthcare services now. And that is one of sort of the core benefits of virtual care is improving access. And when we think about access from a virtual care perspective, we think about providing access across a range of geographic areas. So the easiest way to think about this is a physician being able to provide services to patients that might be in a rural area. And that's one of the sort of first use cases of telemedicine and virtual care in sort of the traditional healthcare system, is that in a lot of rural areas, there are not a large number of physicians. There are certain specialties may be lacking. And so the ability to deliver healthcare services to patients either facility to facility or in the home directly is sort of one of the first really big things that came out of the technology accelerating to this point. But access means a whole lot more than just being able to have a physician talk to somebody far away. It also is something that has to do with time sometimes. And when we think about the social determinants of health, a lot of times we think about people who are low income or who are on fixed income, like older adults. And they may have issues with transportation, even if there is a primary care center nearby or there is some sort of healthcare services. Virtual care is convenient and doesn't come with the difficulties of transportation, getting in a car or driving to a healthcare facility. It also it deals with the social determinants of health in that there are oftentimes people who might work multiple jobs or might be unable to afford childcare. And so when getting home from work and having to take care of children, it's hard for people sometimes to get into a healthcare setting, to get into a healthcare facility. And so telehealth provides a convenient, sure, a good experience, but it also provides a much needed and necessary way for people to still access healthcare services in between their jobs or in between childcare opportunities. And so that's something that gets lost quite a bit in this discussion when we often think about virtual care providing services to people who are only in rural areas or in global health perspective in countries that might be more remote. But it's something that can provide access and connected care to people who might live in an urban area where there's plenty of healthcare providers, but there's a lot of other things that inhibit and are barriers to accessing healthcare services. And one of the things that I think of quite a bit in this space is if there's a working mom, for example, a single working mom who might have a job and then has to go home and take care of the kids, that 15, 20 minutes while sitting in the living room that they can access a healthcare provider is an extremely important thing for them, rather than having to drive maybe 20 minutes to a clinic, having to wait in the waiting room, maybe bring the kids with them and have to sit there and then go through a clinic and then drive home. That's a lot of time And it often is actually a barrier to people actually accessing healthcare services. So that's one of the things that I think is really important to recognize about the power of this tool. It's a tool. It doesn't replace in-person services, doesn't replace the need for physician relationships. In fact, it's just a tool to extend that and to make things more convenient and reflective of the patient experience. So that's sort of the access component of what I think virtual care really provides. Now, what's been a really interesting topic in health policy and healthcare services over the past several years has been the social isolation and loneliness epidemic. It's particularly relevant right now during COVID-19 because social isolation is one of the tools used to stop the spread of the virus. But social isolation has been a problem in the United States in particular and around the world for several years, and research is starting to come out about how it relates to healthcare outcomes. And some research is actually suggesting that loneliness and social isolation can be as damaging to health as about 15 cigarettes a day. So there was a recent study that compared the two, and it's a big problem, particularly among older adults and seniors, such as the patients that Dr. Syed typically takes care of at ChenMed. Older patients, patients on a fixed income, patients who are maybe dual eligible for Medicare and Medicaid, or maybe older adults. Sometimes older adults are stuck at home, and we know that 43% research from has recently come out showing that 43% of seniors feel lonely on a regular basis. And this feeling of loneliness is what can contribute to bad health outcomes, to the exacerbation of chronic illness. And it's actually starting to come out as sort of a really big issue and a factor that is something that's modifiable. So it's something that can be taken care of. It's something that can be addressed very, very easily in order to help improve outcome and the quality of life for people who are experiencing loneliness. What's really interesting is there's a 45% increased risk of death among seniors who report feeling lonely. And that's, we know that based on the previous statistic I said, that 43% of seniors feel lonely on a regular basis. That's a large number of people. And, with that increased risk of mortality, it's coming out that this is something that we need to pay very close attention to. That's in terms of virtual care and being able to do check-ins with people. One of the other powers of virtual care is the efficiency and the speed to which it can actually provide services. And so besides just being able to provide access, it's also a very efficient technology to use to be able to build new models of care for people. And so when I think of the power of virtual care, it can be check-ins with patients. It can be building a sort of peer support networks. It can be using community health workers to either check in person with patients that's scheduled through a virtual technology, or it can just be setting up an older adult that's in the home with a tablet or some other device to be able to do check-ins with their healthcare providers, or to be able to do check-ins with social workers, to be able to do check-ins with volunteers who want to check in on older adults. And so being able to build those relationships via this sort of really intimate technology is something that Dr. Syed and I talk about quite a bit, is that the intimacy between a physician and a patient, or between a caregiver and a patient, that can be achieved through this one-on-one conversation medium is really, really powerful. And so the ability to kind of have more frequent check-ins with older adults that might be in the home, rather than, just coming into the clinic every once in a while. But this gives sort of a convenient and efficient way to be able to check in and to help potentially impact some of those feelings of loneliness that occur on a regular basis. What's happened most recently, or what's really gained a lot of attention in this space, is that former U.S. Surgeon General Vivek Murthy, he wrote a book called Together, and it's a wonderful book. Highly recommended if you're interested in learning more about how loneliness and social isolation is impacting health. But he discusses loneliness as a public health crisis. It's something that is contributing to a lot of mortality. It's contributing to a worse outcomes in healthcare. It's contributing to a lot of costs when people end up exacerbating their chronic conditions because of it. And so I really see, and Faisel and I both see, the power of virtual care being able to help build those relationships and And while it's not as efficient to have hundreds of people and nurses and healthcare providers going out to patients' homes all the time to be able to combat loneliness, it is possible for the development of care models and for that relationship to be built over virtual mediums. So I think it'd be interesting to take some questions now that I've presented and had this discussion. And for those that have joined late, Faisel and I'm not Dr. Faisel Sayed, though I am on his account. He's had a family emergency with his son, and so we had to kind of flip the script here today for Fridays with Faisel. So it's just me, but we'd like to invite. So if anybody has any questions about sort of social isolation and loneliness and access about how it relates to virtual care. So I'll open up the either the comment section or we'll see if we can pull somebody in here to actually ask their question live. Anybody? I know Dr. Faisal Sayed is the one who brings a lot of this information to life through his real stories and through his patient interactions. So we're definitely missing that during today. But what I hope is that this has been interesting and it's been helpful and it's been thought-provoking. I highly encourage everybody to take a look at some of the resources online about how loneliness is impacting health outcomes and how it's actually becoming a very core focus of public health efforts these days. But thanks, guys. I'm excited to hopefully join next week when Dr. Sayed's back. And thanks for joining Fridays with Faisel.